Barely click on your website. All right, so new boosters coming out.
Oh,
This
new
was
new
approved.
season of iCarly.
Uh,
Just kidding. I don't watch that.
Gosh dang, you made me click on that.
Well, that's a good picture of the COVID-19.
So new boosters, they go who should get it.
Why would we call it COVID-19 if it's a new strand? Why don't we call it
That's its
COVID-22?
origin.
That's the
It
origin.
keeps mutating, so it's just stepping back into its origins. But anyway, I can tell you that my sources, unfortunately I can't reveal them. Public health officials like CDC, whatnot, they're not talking about the booster. So it makes me believe that it's just a pharmaceutical push. Because the only people I see right now on TV are lobbyists for
Yeah.
pharmaceuticals, right?
Yeah.
Saying, oh, new strands coming out. Here's another fear mongering thing. And we got to urge Congress to buy this. So they provide for everyone free. And you see Biden out there urging people to buy it. But right now, okay, yes, technically it's true that there is an uptick in infections and hospital rates, but it's nowhere near what it was before the
Not even
last
close,
year, the
correct.
2 years before. And we've innovated to protect ourselves better with better immunity. We have treatment now. We have better methods of staying healthier now that resist against this variant. This variant is far weaker than other variants we've dealt with before, so we're going to be okay.
Yeah.
Like I said, the public health officials I've been hearing from, they're not talking about it. No one's really talking about it. The only people talking about it is just the pharmaceuticals. And heard another push for mask mandates. No one's also talking about that in public health. So, from my experience, I think it's just another thing to tear us apart. Maybe it's just something to distract us again.
Yeah, I think it is. I just know too many of my friends that are like from military background, this and that are right winged, or some that are even like not right wing, but they have the whole like libertarian mindset. They don't want to be told what to do, right? They don't want you gotta wear a mask. Why? I don't
If you're
know.
in the military, you're always told what to do.
Yeah, but right now, I don't know about you, but I've been going out to more and more stores and seeing, like, especially grocery stores, and seeing employees wearing masks.
Understood. I would say let them be them. As long as they're not pushing that agenda on you, it's fine.
Like, I don't care if you do. I just
That's
don't.
what I'm trying to get at. Like you
Like,
shouldn't care if someone has a mask, but don't be a jerk about it, and they won't be. As long as they're not a jerk to
yeah.
you and you're not a jerk to them, it's fine.
You know what I hated is at the height of COVID when you were able to go back to like Fry's, they had these shields, and then you had the girl with the mask, and she's telling you, and you're like, what? And then she would get mad because you're asking what. But I was like, hey, understand there's a shield. Understand you're wearing a mask, and what you're telling me is muffled. And I'm being polite and saying, excuse me? And you're getting mad. I had that one time at Fry's. This grocery lady was pissed because I had to ask her, twice. And one time, three times, what she asked, because she didn't say a dollar amount because I could see it on the register. She asked a question. I was like, excuse me? And she asked it again. And I was like, I can't hear you. And she goes, "Arr!" She said it louder. I'm like, there's a shield and you're wearing a mask. And she goes, oh. And she put her mask down to tell me. I'm like, duh. But I don't know. I think the world went crazy for a minute. Hopefully we never have to do that again.
Well, the world didn't know how to react to this
Correct.
properly.
But there was so much conspiracy theories everywhere, left and right. And people, fear sells. No matter who you are, fear sells.
But there's different conspiracies, and then people have their bold conclusions, and then there's opportunists like not all doctors agree on anything anymore.
Correct. Ever.
When one doctor has his professional opinion on something, there's going to be another doctor that says no, we should not do that.
Correct.
There's always going to be a doctor who disagrees, and then you have this weird split of these people side with this doctor, these people side with that doctor, and we're always going to remain divided. There's nothing that's going to unify us. Anything, no matter what
Right.
it is. So information like this about educating people about wearing a mask, people are going to automatically react to F you. Don't tell me what to do, and they're intentionally not going to do it.
But I did hate. I hate to say this because I always thought I always saw people driving their car wearing a mask. I'm like, why the hell are you wearing a mask?
You know what? I'll tell you this. I'm guilty of that not because I thought I was going to protect myself, I forget I have a mask on.
Okay, I can buy that.
And that probably could be it. It's not like as soon as I get in my car,
Well, it was
sometimes
you.
I take off my mask.
Yeah.
It was probably me.
It was you that I saw. It's like that fucking guy.
Because
No, it
sometimes
wasn't
I
you.
remember to take it off and
Yeah.
put it in my pocket or whatever and start driving. But sometimes I forget that I have it on.
Yeah. And I feel like that cartoon from The Simpsons, the bully going, hey, hey. But I just hope, just if it comes back, just everyone do what is best for you and your family. Plain and simple. Don't be mad at your neighbor for having different views, because you're always going to have different views on everything. From
Everything.
Sports teams to what cereal you eat, anything, right? So if it comes back, do what's best for you and your family. That's it. Don't tear someone down because they have different beliefs in you.
Well, the hard thing was you don't know who's infected, but you could be risking other people
Correct.
with your behavior. And that's what the core thing that people did not like the most.
Yeah, for me, I would just stay home. If it got really bad, I would just stay home. I'm not going out anywhere. I'm not going to the gym, because the gym, people are touching the weights and stuff like that. I'll just work out from home, and I'll let it pass. And I'll order food from Fry's delivery or something like that, and just.
Well, not everyone has that privilege.
I know if you live down the country and stuff, yeah, it'd be hard.
Mm-hmm. Not everyone has like a mobile service where they come to you. You still have to go to the store. And also the whole mask thing, it's not just COVID. It could be like maybe someone is sick with the flu, doesn't want to infect others, is being mindful, but like, I have to go to the grocery store to get my medicine, get my food, and leave. Please don't get mad at me. I could get you sick with this flu.
I think it's also fear. I do have a girl in my office that wears a mask all the time, and I asked her sister, "Why does your sister wear a mask?" She doesn't want to get COVID, and I was like, "Oh, I understand." And I wanted to say, "Is it because she's fat?" Because she's a big girl. Oh, I just realized that you're a subscriber. Shoot, sorry.
Well, what's the mask are they using?
They're wearing it all the time.
What type of mask though?
It's the blue one, the cheap one.
That won't prevent you from getting COVID though. You have to have like an N95 mask.
No,
on.
it's the cheap one. It's the cheap one.
It's okay.
She wears the cheap ones.
And it's unfortunate because you're still breathing in outside air. It's not being filtered through the
Right?
mask.
It's the cheap one. You can blow out a candle and stuff. But I don't know.
Oh, well, if you could blow through it too?
Yeah, you're screwed.
Yeah.
You're screwed.
I thought it was like the surgical mask that you see doctors
They're
wear.
the cheapest of the cheap. They're the cheap ones that you can blow out. But
that's still unfortunate that education still has not come across. But the thing is, like, we are not capable of moving information quickly.
Yeah.
And as soon as there's updated information, people still hold on to the old information.
Yeah.
While there's other people who have the updated information, then you have this disconnect and it just goes and spirals out of control.
What do you think of ivermectin? Joe
I don't
Rogan,
know,
when he
'cause-
came out with ivermectin, everyone like shit on him. Everybody.
Well, the thing is, there's so many tools we use to combat COVID. And maybe ivermectin works, maybe it doesn't. I'm not a specialist in treatment. Maybe it did work, maybe it didn't. Because what's unfortunate that our government push was like they made the vaccine like the one and be all. They didn't say it was like one of many tools.
Which was weird because there was nothing for prevention. There's nothing like, hey, if you're to help you start having vitamin C, zinc, all this stuff. There wasn't any push for that. It was take the vaccine.
Yeah, it was like take the vaccine, not like have better health, watch,
Correct.
eat healthier. But then when you start telling people to eat healthier, you're screwing with someone's business. You're screwing with someone's money. And then those people will have their own agenda to spread through social media about how everything's BS, continue eating, you're fine.
Yeah, eat the cheeseburger from McDonald's. Yeah, it's 50 cents tomorrow.
Yeah, because it feels like if they're telling me not to, like, say I own Oreos, and then the government says, hey, don't eat sugary snacks like an Oreo, then I'd be mad because you're messing with my money, and then
So
I'm going to
much
make my
sugar.
own videos saying how the government's corrupt and how they screw up everything, and then you're in this weird spiral, and people don't know what to believe.
True.
So we have the information about good health. Do people actually follow it? No, most Americans don't. Most of us are overweight. There's plenty of information out there that you can find about good, healthy lifestyles.
Yeah. Thanks for watching our clip. If you want to see more clips like this and you like our views, like the show, click here for some more clips. If you want to hear the whole podcast, watch the whole podcast, click here for the whole podcast. Remember, like, subscribe, hit the notification bell, and we'll get back to you. Thank you and have a great day.